Hello, everyone. Dr. Shadia Rayford here, board certified surgeon, owner of Vet Triage. Today, this live stream, where chances are no one's going to be attending, but that's okay, because I hope in the future they will. We're going to talk about wounds, lacerations, bite wounds, attack, things like that for your pet in general, because this is a very complex topic that even veterinarians, even surgeons will have a difficult time with or disagree with or whatever it is. So this is not meant to be a master class in wound repair or anything like that. It's more from a pet owner's perspective, and maybe some of the veterinarians who are listening to this, their perspective on how we want to tackle wounds and things of that nature. So any questions, go ahead and leave it below. If you have any other topics you want me to talk about in future live streams, where I'm happy to dive into them. I'm going to try and click on an emoji here and see if it pops up on the playback. So anyway, let's talk about wounds and bites and cuts and things with your pet. So not every single wound is an emergency. Not every single wound needs surgery or some other kind of repair. Some wounds are straightforward repair, straightforward healing. Others have complex repair and messed up healing and everything in between. It varies widely. And it's mostly because animals are animals, right? They get wounds and cuts and whatever for various reasons, whether it be from their housemates getting into a fight, whether it be wildlife, whether it be they jumped off a deck, they fell on a fence, they got hit by a car, whatever it may be. There's a variety of ways, but I'm sure it's not that different than cuts and things in people. And just to be clear, wounds, we technically call them lacerations. That's the medical term for them. You can have different types of wounds. That could be like bite wounds, for example, which are puncture wounds or sharp wounds. You could have more like blunt type wounds, let's say secondary to severe bruising from being hit by a car, so blunt trauma, and the vascular supply, the blood supply to that area ends up being compromised, and so you end up with skin that dies off, and that creates a wound. You could have a no laceration or wound or whatever, but there was an infection, let's say a bacterial infection for some reason that got so bad that the skin opened up. So my point is, any defect in the protective layer of the epidermis or musculature is considered a wound or a laceration or whatever. The cause of it, of course, can vary, but the end result is a penetration of the barrier for the skin, muscles, fascia, subcu, fat, etc. So when it comes to how to manage these, like I said, I do encourage vettriage.com, obviously, but for this topic, because not every wound is an emergency where you have to drive 3 hours to the nearest emergency hospital and then wait 6 hours in their lobby before you're finally seen to be told that you didn't have to be there. This could have waited till tomorrow for your family vet to open, or waited until Monday or something for your family vet to open, or maybe surgery is not even needed or something. And so I do encourage vettriage.com so that you can get some insight as far as what the best direction to take is. Similarly, not every wound requires medication either. Most people, of course, automatically assume they need antibiotics, and that's not always the case. It's commonly the case, sure. Some of it is done because the pet actually needs it, because of the circumstances involved, whether it's the pet's comorbidities or whether it was whatever was the source of the bite wound or puncture wound or laceration. And there are some situations where doctors are doing it prophylactically. It's more of a defensive medicine type of mentality where they're doing it just in case. So they don't regret not doing it later on when it becomes infected and it's a bigger issue. Whether or not that's right or wrong, I don't know. You have to go based on the veterinarian's experience level. But unfortunately, we live in a world where veterinarians, just like medical doctors, are prone to getting in trouble by angry pet owners who are dissatisfied with the care they received and the outcome, and then they end up complaining to medical boards or refusing to pay bills or whatever else. So unfortunately, this is the world that we've created. And sometimes antibiotics are used for protection purposes of the veterinarian rather than what's the best interest for the pet. Antibiotics are not all good either. There's obviously pros and cons, just like anything else, but that's maybe is a good topic for another time. Okay, so your pet has a wound. and you're trying to figure out what to do. The doctor's assessment is going to be, number one, is there any overt involvement with major blood supply? Like, is there active hemorrhage, active bleeding? Is there any chance of penetrating into the underlying bone? Is there a bone fracture or bone exposure to that area? Are there any tendons or ligaments that are exposed in that area? Is there a possibility that this laceration has entered any major body cavities like the chest or the abdomen? Those are also concerns. And then if the wound was caused by major trauma, hit by a car or being attacked by animals or whatever it is, then what other internal issues unrelated to the wound are there in that pet? Are we dealing with air leakage from the chest, a pneumothorax? Are we dealing with urinary leakage in the abdomen, so uroabdomen? Are we dealing with biliary trauma, so gallbladder? Are we dealing with intra-abdominal hemorrhage from like a splenic rupture or a liver rupture? Things like that. Are there any internal issues that we're dealing with? And many other factors, but I just want to give you some basic kind of concepts. The doctor first has to assess how severe is this wound. Is it a life-threatening situation right now, or can this be given palliative care? And the reason why that's important is because if a wound does require surgery, it may not require surgery at the moment of the trauma. It could potentially be where in that veterinary clinic, it behooves them to have this repair done in a day or two, maybe because of staffing issues, maybe because the doctor who's going to be on in a day or two is more proficient in these types of wounds. Maybe the pet is still in shock and needs to be stabilized further before undergoing anesthesia for the wound repair. So there are times where if the doctor can delay the wound repair, they may want to for good reason. Or sometimes the wound may what we call declare itself, where the wound you're seeing right now, merely minutes or hours after the trauma occurred, might change in a couple of days, and the surgery you would have performed right then and there after the wound happened will fail in a couple of days because the wound would have declared itself. So wound declaration is where the trauma of what caused the wound is progressing beyond the time of the wound creation. So usually a result of poor blood supply. The blood supply has been compromised. The underlying tissues have been compromised. So the affected tissue is effectively dying, but you don't see those results. You don't see that outcome minutes or hours later. You see it days later. And it could be lots of days. It could be 5, 6, 7 days later, depending on the wound. And I'm sure there are vets out there who watch this that are like, yeah, I had it happen 2 weeks later or something. So it's very tricky. And some of that's predictable. There are certain traumas like crush traumas or blunt traumas that are more likely to declare itself later. There are some pretty nasty bite wounds. So not all bite wounds are created equal. Cats in general tend to have nastier bacteria in their mouth when it comes to bite wounds than dogs do. Wildlife tend to have nastier bacteria than domesticated animals. And so, and just so those statements are anecdotal. That's my own experience. I'd have to look at the literature to see whether or not that's actually been shown. But in my experience, that is quite clearly the case. And so, and so sometimes the veterinarian can predict when wounds will declare themselves, and sometimes they can't, and that's just the nature of it. So that's step one: is this wound life-threatening in any way? Are we risking loss of eye, limb, life? And if not, then can we band-aid this until the patient is more stable and have the appropriate doctor, surgeon, staff repair the wound, and then go from there. Wound repair can come in a variety of ways. And again, this is very, very broad. Primary closure, which is the complete repair of a wound, is what most people think when they think of wound repair. There's the wound. Let's make it what it was before the wound happened, right? Let's reconstruct it. And so sometimes you can do that if there's enough tissue there, if the wound is pretty recent, if the pet is not in shock or doesn't require any other stabilization, etc. There's also a secondary wound repair, or second intention healing, where we allow the wound to heal on its own. So it's second intention. It's not primary closure. And so we let the body take care of it. And the veterinarian's job is to help support that pet's body to heal that wound on its own, as effectively as possible. And that's second intention healing. And there's delayed primary closure as well, where you plan on closing this wound, but you're going to do it later, not right now, for whatever reason, whether it be logistical reasons like staffing issues, or whether it be for the best benefit of the patient because they need to be stabilized or whatever. So it's not second intention healing. You're not going to let the wound heal fully on its own. You're going to close it primarily, but you're going to do it later and not immediately. So wound repair, the timing of it and how we do it depends. Some wounds are really simple to repair. It's simply putting the two ends back together. And there are others that require really fancy reconstruction and skin flaps to repair. So just keep that in mind. There are some areas of the body, especially like the anabrachium, so the forearm, or the lower extremities of the pelvic limb, that there's not a lot of tissue there. And so sometimes you have to either let that heal by second intention or skin flaps and other permutations of skin transplants. So those are all just factors to consider. There are also location of the wound. Wounds that are located under like the armpits or the axillary region or the inguinal region or groin area can be a bit more difficult to heal. Those on the sternum, if you have a dog that's always laying on their chest at home, those will be more difficult to heal. And the reason why is because they keep laying down their chest, they're always putting pressure on the wound, on your surgical repair. If the wound is under the axillary region or the inguinal regions, then there's a lot of motion there. You can't stop the pet from walking. And also those are areas that tend to retain moisture. So it's more likely to compromise your wound repair. So the doctor has to focus on that. When the doctor places closes the wound, is there tension? Meaning, is there a tightness to when the doctor closes it, or is it opposed pretty nicely without any tension? Tension is a killer for skin repair, wound repair, just like infection is, right? Just like hematomal formation is, just like excessive moisture is, excessive dead space. So dead space is where there is literally space between the superficial layer of tissue and the underlying tissue. There's space there. And the reason why that's detrimental to wound healing is because if there's space there, the body's intent or the body's reaction is to fill that space up with something. It usually fills it up with fluid. And if it fills it up with fluid, that means the vessels that are trying to permeate from the deeper layers to superficial layers can't make it. Plus, bacteria love fluid. And so if there's bacteria in that wound, they're going to thrive in there. There's motion as well with that type of scenario too. And motion doesn't help wound healing. So those are all those factors to consider. And again, just to give you the idea that this is more complex than just putting tissue ends together. And then the doctor may help protect the wound by other means. So for example, you may have heard of drain placements. There are two types of drains. There is active drains that actively suction out fluid and debris and bacteria and dead cells and all that stuff. And there's passive drains that are gravity dependent, where it allows for fluid and debris and whatever to leave the body in a gravity dependent manner. And so, whether your doctor places a drain or not is up to them. And, the drains, of course, are not permanent. They are eventually removed. The most common passive drain is a Penrose drain, and that usually stays in the patient a couple of days. The most common active drain that I know of is a Jackson Pratt drain or a JP drain. And that could stay in the patient for a couple of days to a couple of weeks, depending on how bad the wound is and how much fluid is being produced. But the idea behind placing a drain is that dead space that was there, if you can't seem to repair it or remove it at the time of surgery, the drain will hopefully help keep that area decompressed so that the chance of the repair or healing on the first repair attempt is successful. So, and then, does your vet put a bandage over the wound or not? I tend to place a bandage over the wound if I feel as though the pet is going to put a lot of pressure on the wound, or it's a high motion area, or I'm worried the wound is already kind of compromised. The patient has other comorbidities that prevent them from healing normally, like they are geriatric, they've got diabetes, they have cancer, other hormonal diseases, endocrinopathies, things like that. So that all depends on whether I place a bandage or not. And and then basic stuff. Does the pet need antibiotics? Yes or no? Do they need analgesia? Do they need anti-inflammatory? They definitely, for the most part, are going to need a cone to prevent licking. And as long as we think the pet can reach that area, I don't care what kind of personality your pet is, how nice the repair was, bandage or no bandage, they get a cone on. That cone is vital to healing from surgery, because you can have the best and fanciest, most expensive repair, and the pet will undo all that hard work in a matter of minutes to hours if they have access to that wound. And they will lick and bite the wound. As the wounds heal, it'll get itchy. Just by that alone, they're going to feel compelled to itch it. Anyone who's ever had a mosquito bite or a wound repair for themselves knows that these things get itchy. So I think that's a pretty good overview of wounds and lacerations. It's a very complex topic, of which there are many surgical texts written on this. But I figured from the perspective of keeping it kind of simple, that's a good start of how to handle wounds and repairs, things like that, or wounds and lacerations. So any questions, feel free to leave it below. Any suggestions, feel free to donate, support the channel, subscribe, hit like, all that good stuff. We'll see you in the next one. Hopefully we will have an audience. And you guys have a great day. And hopefully we'll see you tomorrow on Sunday, June 9th. And today's Saturday, June 8th. So it was fun. Talk to you soon.